One of the hardest decisions for us as a dentist is when we have to tell our patients that they're going to lose all their teeth, whether it is because of advanced gum disease or rampant cavities. It is the toughest treatment plans to present to patients just because of all the trauma and the psychological aspects of having to lose all their teeth. But luckily, with the advancements of implants and the digital workflow, we're able to help the patients get from the time when they're going to lose all the teeth to the time that they have a permanent prosthesis in, with minimum interruptions to their lifestyle and with minimum trauma, pain, discomfort, and time in the dental chair. So let me share with you how we do it, and hopefully you'll get the benefit out of my experience. Let's go through an example. This patient will lose all his upper teeth. First thing we do is we'll take an office CT scan, and then we take the CT and we merge it with the intraoral scan that we obtained by the digital impression. With the two together, we'll design the implant surgery and we make a surgical guide. The surgical guide will ensure that the surgery will be done more accurately and with good speed. So at the day of surgery, we have surgical guide, we have a prefabricated temporary ready. We go in, we take the teeth out, then we position the surgical guide on top of the teeth, place the implant, and then provide the patients with a fixed temporary in the same appointment. So the patients leave the office with fixed teeth that will be able to function on them right away. Waiting for 2 months of healing, then we start the prosthetic phase where we make the digital impression. Then we design the final prosthesis. Each case is different, but what we like to do is we would like to have a very nice looking porcelain teeth on top of either a metal framework or an all ceramic framework. What digital dentistry will allow us to do is to try every single step. So here we make a 3D printed temporary that will like to mimic the final and how it's going to look like. We let the patient try it, go home with it, eat with it. When the patient is happy and completely satisfied, then we can proceed to make the final prosthesis. By doing it this way, there will be no surprises or guessing, or is the final going to look good? What you see is what you're going to get, and the digital dentistry will allow the patient to go through a test drive, and when we like it, then we go and proceed to the final. We deliver the final, and then usually these things can either be cemented or screwed on. Either way, the patient will have a final prosthesis that went through a lot of steps of verification, so he or she will not be surprised about how the final outcome is going to look like, and that will relieve a lot of the stress and the I don't know factor out of the window. At the end, we get a great result, a result that the patient is happy with, that they feel confident, and they go on with their life. For more information, please go to our website, and please do not hesitate to call the office and set up your complimentary consultation.